Welcome everyone with the Mental Wellness Adaptive Study. I'm Dr. Josie Schmidt. I've been a naturopathic physician for just over 20 years, and I retired about 6 years ago from clinical practice to work solely on educating and empowering people to work with essential oils in their daily lives and daily wellness. So let's get down to it and learn more about the Adaptiv line and the Copaiba that we're working with in the study. So we have 4 things that we're working with: the 2 adaptive oils, the adaptive capsule, and the Copaiba. And these are a really incredible addition to your toolbox for mental wellness. I want to highlight a couple things about essential oils in particular, and how they work in the body. So the only difference between the 2 oils that you've received the sample of, the one with the roller bottle, the Adaptiv Touch, and then the adaptive oil, is that the Adaptiv Touch with the roller bottle is the oil blend in a carrier oil, fractionated coconut oil. That's the carrier oil of choice with doTERRA. And so they're the same oil blends. You just have one pure essential oil and one that is with coconut oil. The reason we put essential oils with a carrier oil like coconut oil is that it helps to slow down the release of the oil as it is absorbing topically in our system. This makes it act like a sustained release capsule, right? With this beautiful phytochemical plant medicine. So when you are using the roller bottle and you're rubbing it onto your wrist like this, your wrist creases, or on your fingertips, so you could do the back of the neck or the back of the ears, you're rubbing it in, yeah? And then make sure you always do a smell. I call this the twofer, right? 2 for 1, because it is absorbing now gently and in a sustained way into your bloodstream. And within a minute, it has access to all the cells in our body, which is quite amazing. But let me tell you and talk about what happens with essential oils when we smell them, when these aromatic compounds, these aromatic phytochemicals, the compounds in the essential oils, pass directly through the cribriform plate right here and have access to our brain immediately, because they are able to cross our blood-brain barrier and have immediate activity in all the centers of our brain. But what is even more incredible, that's pretty incredible right there, is that smell, unlike all the other senses, taste, test, sight, hearing, all those sensory inputs have to pass through the mental processing part of our brain, the thalamus. And so that part of it where we need to think about something, we need to understand it, we need to have recognition, right? They all have to pass through that part of our brain to then get to the emotional aspect, the limbic system, the limbic part of our brain, which is a couple different structures, the amygdala, the hypothalamus, and a few other areas. These are the parts of our brain that process emotions, emotional memories, trauma, and have an ability then that's what then releases the input for neurochemicals and neurotransmitters to be made in the brain. So our immediate reactions that way. Smell, remember I said it's different than all the other senses. Smell is able to bypass the thalamus and go directly to the limbic system. So we don't have to have recognition or understanding of what is going on in a situation to have relief and have what we call a disruption of the cycle. So Dr. Rose spoke about this chemical cocktail that can start to happen with our stress response, right? That HPA axis, and how our brain starts to make all these neurotransmitters and chemicals that then react down to our stress hormones, the adrenal cortex in the body, and produces cortisol, our stress hormones, and we have epinephrine and norepinephrine in the brain. These are all the stress responses, right? So with smell And with essential oils that are these specific phytochemicals, these plant compounds, we can immediately, the smell immediately passes through our blood-brain barrier, immediately bypasses the thalamus and goes right to that limbic system and is able to have our brain stopping and interrupting a cycle, a cascade of thoughts that are now producing those negative and excitatory neurotransmitters that we don't want, that are keeping us in a cycle of stress and anxiety. And it can go these huge breaks and have that effect right away without us even needing to understand what's happening or process it. This is what is so incredible about essential oils, first of all. So I want to stress that the oils right there, using them through the day, and having that sustained release with the touch, so it's absorbing at a slower rate. And so we're having, if you just apply this every couple hours, you're just having your bloodstream kind of gently bathed with these phytochemicals and splashing off, you're smelling. That's what happens in a diffuser. So if you have a diffuser by you at night or in the daytime at work, you are smelling in that phytomedicine, right, from the plants, and you're having those messages happening without you even recognizing or knowing it. It's pretty incredible. So you can also use the straight up oil in a diffuser, or you can be the diffuser. That's what I like to say. You can have a drop in the palm of your hand, rub your palms of your hands together, come here to the back of the neck, and cup your hands together, breathe in. Wonderful. You can put it on the bottoms of the feet. Yeah. So you can use the straight oil and the touch in those ways. Now, the Adaptiv capsule, this also works like a disruptor. It works through our whole system in about 5 hours. So it is long acting, but not super long acting. And the immediate responses happen within half an hour to our brain after taking this Adaptiv capsule. And I'm going to explain a little bit more with all of the ingredients in the Adaptiv, how this actually helps us to, again, be this disruptor for that cycle of that neurochemical cocktail of stress, and really helps us to then give us those tools with our lifestyle toolbox to have different responses, because our brain is producing different neurotransmitters already right away, and our body is producing different hormones. And so we are not stuck in a loop that we have no control over. So there's the beginning of how these oils and this capsule are helping us to work out of our stress response. Let's dive in a little bit deeper. So in the oils, this is the blend of essential oils that we're working with. It is lavender, magnolia, neroli, sweet gum, also wild orange and spearmint, and copaiba and rosemary. That's the full blend. Now notice that it's broken up in a little bit different categories. So we have all of these are incredible stress relieving effects with magnolia, neroli, and lavender. Very anti-anxiolytic. And wild orange and spearmint energize and uplift. And know that both wild orange and lavender, there's beautiful studies on these showing that they have equal to or greater benefit than benzodiazepines, the pharmaceuticals used with generalized anxiety disorder. They have greater or better benefits than those benzodiazepines in multiple studies. Both lavender and wild orange have been shown to have those effects. We know that magnolia is incredibly anti-anxiolytic as well. And then we look to copaiba. Copaiba has incredible actions in our brain in helping to quiet down the excitatory sort of stress brain neurotransmitters, the norepi and epi. And rosemary as well is very helpful for our memory and our brain, and it helps soothe anxious feelings and have a calming effect, as well as an uplifting one. So yeah, I've already talked about using them, whether you're diffusing them and using them topically. This is going to be our everyday lifestyle toolbox, where we're bathing our system gently every few hours, or whether we're having a sustained release with a diffuser, and then working with the topical work with the coconut oil and having that sustained release that way of the essential oils. So looking at the gel cap, it has 4 main ingredients. So right there you see an incredible synergy, and I want to tell you all great formulas. We go back to Chinese medicine, Ayurvedic medicine, thousands of years old. The formulas are great because of their synergy. So the total is much greater than just the sum of the parts, and that is definitely true with this formula. If you took apart each of these ingredients, they are not, that's the one thing that's wonderful, is when we look at them, they're in very safe levels. They are not nearly at the high levels that you'll see in some of the clinical studies of each of the individual ingredients. And that makes us feel good about the safety levels. But when you put them together, all 4 of these, the synergy is incredibly powerful. So when we first looked at the first ingredient here, it is actually a blend of essential oils for internal use. It's not the same as the full blend of oils in the topical Adaptiv line, but you'll notice there's 2 oils that are the same, and that is lavender and wild orange. And so we already said that there are great clinical studies, double-blind clinical placebo-controlled studies with lavender showing that actually at 80 milligrams, specifically that amount, as used in a gel cap taken orally, it has that effect equaling benzodiazepines. Now, what doTERRA, they could have done this, and they had a gel cap with lavender essential oil in it even before those clinical studies were out. They knew the effectiveness. But they were really looking for the synergy of the lavender with the wild orange, and then the coriander and the fennel. Some of these other oils are high in linalool, which is the main ingredient in lavender, that helps produce some of those anti-anxiolytic and calming effects. And they felt that this blend was actually stronger and more therapeutic than just straight lavender all by itself. So we have that Adaptiv blend there of internal oil use at 80 milligrams. And then we have ahi flower seed oil, which is an omega-3 fatty acid. And then we have GABA. This is gamma aminobutyric acid. This is an actual neurotransmitter. The form of the neurotransmitter in Adaptiv is a proprietary, naturally fermented form of GABA. And so it's highly bioavailable. And then scaledium, which is a succulent plant from Africa. In Africa, it's known as kanna. And I'm going to talk a little bit more about each of these other 3 ingredients: ahi flower, GABA, and selenium. So the ahi flower is a very rich source of omega-3. It's a newer one, kind of in for those of us who've been working with omega-3 fatty acids, and really the omega-3 fatty acids are incredible for anti-inflammatory actions and helping to support and nourish the brain, and with all kinds of inflammation in the body as well. Now, ahi flower has been shown to be more bioavailable to us than fish oil. So this is pretty incredible. It breaks down to omega-3 acid that is called stearidonic acid, and it's, for short, it's SDA. And then the SDA breaks down, for those people who are in the know, to EPA and DHA. And this breakdown process is where it is more bioavailable, and it has a better breakdown into those ones, EPA and DHA, that we really, really want to support our brain, even more so than fish oil. This is very exciting. So this is the part of the formula coming in that is helping in a very nourishing way to be supporting our brain and our brain activity with the neurotransmitter activity. Yep. There we go. And then GABA. So GABA is the main inhibitory neurotransmitter. What does that mean? So I think Dr. Rose spoke about the different neurotransmitters that lead up to kind of this stress response that gets in a loop and out of control. And in the brain, GABA is the brakes. It's supposed to be the brakes to all that. In a normal functioning brain, it helps kind of weed out the static, and it helps to get us to be able to focus. So it's very helpful if you have trouble and you know, for people who have focusing issues, having some additional support with GABA and brain functions to support GABA are very useful. But it also is that for norepinephrine, epinephrine, and that cortisol cycle, GABA is the thing that's supposed to put the brakes on. And you know, on your car, if you like get in a situation where it's like, you know, threadbare tires, right? Because it's been so overactive. So you have these tires that are threadbare. What do you need to do? You need to apply the brakes on even more, right? You have to really put the brakes on. So that is why we get to, in a situation, if people are out of control and in a loop that they don't feel like that they can calm down themselves, that we need some extra support and extra help with something like the GABA. Now it's a low dose. It's 100 milligrams of GABA. And when you see studies on GABA, it starts at 400 milligrams and could go up into the thousands. So this is a gentle dose. It's a supportive dose. And again, it's powerful because of the synergy of the entire blend. All right. So it's the neurotransmitter, right, with the overstimulation of neurons that lead to anxious feelings. And then selenium. So selenium, this kana from this beautiful succulent from Africa. In Africa, they chew on it, they make teas from it, and it is really used for analgesic, for pain relief, and for calming down and being a sedative. And it has 4 different main alkaloids. And so doTERRA is using all 4 of those alkaloids together in a patented form called Zembrin. And these alkaloids are specific for helping to increase serotonin and also decrease the serotonin reuptake. So you guessed it, it's like a natural, mild, slow-acting SSRI. This is what selenium actually does in the studies that they have been doing and finding out about this root that's been used for a really long time. They're seeing that it has just those actions that are desirable and wanted from SSRIs, so helping with increasing our serotonin, both by decreasing the receptors to uptake it and to actually help our body to produce more of our own serotonin. And know that selenium, the alkaloids in here, and the GABA really work synergistically together. Serotonin and GABA are totally intermingled and linked in our bodies. And so they need each other to work correctly. And so this is really powerful to have the synergy of the selenium root together with the GABA. Yep, supports the body's ability to sustain both serotonin and GABA. And then we know that helping to support our serotonin and our dopamine, it's both, that is really that other end of the spectrum, right? So we just, with this Adaptiv line, we are not just working with the anxious side of our neurotransmitters. Our neurotransmitters all work together. It's really, Adaptiv is helping to support as well the serotonin and the dopamine, and that it's really about balance, the synergy of the formula and the balance of our neurotransmitters. So I know Dr. Rose spoke about her experience of how it was helping her with more of the situation where she was having difficulty with pain and feeling those kind of depression and sad feelings, and that the Adaptiv helped her incredibly, and she was surprised by that, actually. And I can tell you for myself, my own story really is that I would not say that I identify as that I struggle with anxiety or depression. And so I've taken the Adaptiv capsules intermittently, and we were prepping for the study, and I was having a lot of anxiety, and there was a lot of work going into it, and I was feeling stressed and overworked. And my colleague Aisha, we're working together with the videos, and she was like, have you been taking the Adaptiv capsule? And I was like, no, I'm the doctor. I'm teaching about the Adaptiv capsule. And she's like, you need to go take it, right? And it was this reminder. It's such a good reminder. This is for all of us in different times and different periods of our life, right? We need that disruption to happen at different times. Some people are in a more chronic cycle, and they need to take the capsule for a while, because that disruption, those breaks, it's taken a long time to build up to where they are. So they're going to, the breaking period is going to be a little bit longer. Other people who are not in a chronic situation, they could take it for a couple days or a week, and that's it. That's enough, and it gets you back into your normal flow, and you're using the oils then in your normal support and toolbox. So there's a wide spectrum of how we use the capsules and when we need to use them. So I just wanted to add that in for everyone, that it's situational, and our situations are all very different. Now I wanted to do a quick overview of Copaiba and why we added it into the study. So Copaiba, I say Copaiba, it's really Copaiba, is really broad spectrum, this oil. It works to help with our livers, our antioxidant support, our health, cardiovascular, immune, digestive, respiratory, and neurological. And so one of the main things to know about Copaiba is that it is actually working on our CB2 receptor. This has gained a lot of popularity recently because of CBD, cannabidiol oil from hemp. So Copaiba is from the sap of a tree. It is a non-hemp CB2 receptor agonist oil. What that means is it is working on the same receptor in the brain, the CB2 receptor that CBD oil works on, for immune support, for anxiety, stress, and sleep support, and also for inflammation and pain relief, right? All of that, all those things that we know CBD oil, that's the CB2 receptor. But whereas CBD oil is indirectly plugs into the receptor, the CB2 receptor, that means it's not a full direct fit, right? It's an indirect fit. That means you need a lot of it. Have you ever wondered why it's so expensive, those therapeutic doses of CBD oil? That's why. You need a lot of the therapeutic dose, because it's indirectly works on that receptor in the brain. Copaiba is a direct receptor agonist. It works directly into that. You don't need a lot. You just need a little bit, because it has a direct receptor activity. It just immediately turns on that receptor site. And on top of that, the thing that directly works is the constituent is called beta carotene. And it has a huge amount of this beta carotene. We put in here, I just want you to know, 65%. That no other oils have 65% beta carotene. When they found this out, they were amazed, because beta carotene is so very powerful. And just a little here to show you this. So the CBD, cannabidiol, it's present in low qualities, and it doesn't act directly. And then we know THC, that's the thing in cannabis that interacts with the CB1, and that gives you the psychoactive properties. None of that with Copaiba or beta carotene. Beta carotene works only with the CB2 receptor directly and very powerfully. So what this means is that you only need 2 drops of Copaiba, and it has a long acting in our body, 7 to 9 hours. So really you only need it morning and evening to have a full, that sustained release action in the body. And the 2 drops is a therapeutic dose. This is really, isn't that amazing and powerful that you can have 2 drops under the tongue of Copaiba in the morning and evening is giving you a full therapeutic dose of like very high quality, the highest quality CBD oil that you could find. And I love that. The other thing you want to know about Copaiba oil is, so that beta carotene is what is known as a sesquiterpene, and this is the category of constituent that it is in organic chemistry. And the sesquiterpenes have the ability, remember, to directly cross the blood-brain barrier. So when we're putting it under our tongue, it is absorbing into those into that bloodstream there, and when it's coming up to the brain, it is directly able to cross through that blood-brain barrier and stimulate the limbic system. So also smell it when you're taking it. Smell it. It doesn't have a huge smell, but it's going to directly, again, remember, bypass the thalamus and affect that limbic system of our brain and increase the oxygen around the hypothalamus, pituitary, pineal. Do you think that's going to help us in our balance and our production of our neurotransmitters? Yeah. It's incredibly antiviral, anti-inflammatory, and then it also, I love to say that how anti-inflammatory it is. It helps to inhibit the activation of NF-kappa beta. For anyone who knows about that, that is the factor in our bodies that is really active in chronic disease states such as arthritis, cancer, asthma, neurodegenerative diseases, heart disease. So it actively inhibits the activation of this. It is incredible in so many ways in our body, with our immune system, with our brain, with our neurotransmitters. It is a very powerful oil. So in encapsulation here and finishing up for everyone, this is where you get to decide whether you'd like to trial and add in Copaiba with your protocol. If you feel like you are good with the Adaptiv, then that's wonderful. Stay there. If you would like to trial the Copaiba, feel like you would like some more improvement, or you would like to see what it feels like in your body, then you're going to work with your little 5/8 gram bottle, and it's a little bit of a thicker oil. So what I suggest to people is that to get it under the tongue, you want to tap the bottom with your finger. And so open your mouth and go. And about 5 taps is going to equal about 1 real drop of oil, right? So these are, you don't get a full drop out of this little baby bottle. When we say 1 to 2 drops, we mean what comes out of the original bottle. So 1 to 2 drops you're going to get if you do about 5 taps like that. And so you can try that once or twice a day and check in with the person who invited you to the study. And I hope you continue to have, everyone continues to have a wonderful time with the study, learning, embodying with yourself, feeling into what is happening. How are these, are you feeling disruption in that cycle? Are you understanding that cycle more for yourself? What's going on? We're very excited to hear feedback from everyone, and we want to thank you so much for working with us. Okay, bye-bye.